All right, we are back inside the 3-point conversion sports lounge. Sorry, um, we have Doctor Donnie, I'm sorry, Doctor Donald Fowler, the third,
Either one's good.
orthopedic for OrthoAtlanta. How are you doing today, man?
Doing good. Good to be back in the studio this time.
You said you're upset about the Harper deal, right?
Yeah, I'm a DC native, so tough pill to swallow. I mean, I respect the guy, but going to a division rival like that is a little deep with the wound, but we'll see.
They offered him a lot, but they say a lot of it was deferred. Like
Yeah.
he'll get it until he's 60. I
Yeah.
kind of get it. Like, dude, I want
So
my
a
money
Bobby
now.
Bonilla contract.
Right? Yeah, they tried to
Yeah.
Bobby Bonilla.
Nah, and honestly he's earned the right to go and do what he wants to do. So,
Why you gonna try to
yeah.
defer my money? Don't put me on layaway. let me get all my
Yeah,
money
what if something
now.
happened?
Let me
Yeah.
get all my money now.
That's crazy. Now, you know, we ask you about these. We have to ask you about the injuries and why and who and what. Now, yesterday at the NFL Combine, Oklahoma State running back Justice Hill, he came out looking good. He ran a 4.4, led all running backs in every drill he participated in before coming up lame in the second 40 attempt. We see this a lot, how can players prevent this from happening? Is it more of what they're not doing beforehand or what they need to do, or is it just the power of like luck?
Yeah, it's tough in these, especially speed athletes with that explosion. I think it was a hamstring for Hill, and it's pretty common. Certainly, there are preventative measures you can take. Certainly, warming up the right way. You usually want to at least jog and loosen up before you stretch. And then, of course, in preparation, you certainly want to be practicing 40s, at least the starts, that explosion kind of coming off the line, so it's not a shock to your body. We're doing new things with training techniques, stuff called eccentric exercises, where you're strengthening muscle as it's lengthening rather than contracting, and that tends to prevent against these injuries. So we're trying to change the way people prepare so it decreases, but some of it is still luck of the draw.
Yeah, I would think after knowing everything he's done, you don't hold me back because I pulled up a little lame on my second 40. You know,
I read somewhere yesterday that the 4.4, the almost 11 feet in the broad jump, 40-inch vertical. There's only been one other running back in the last 15 years of the combine that's done that. Barkley.
Okay,
Barkley
yeah.
last
Come
year.
on, he sounds like he need to be the number one back off the board.
And I'm not saying he's going to be Saquon Barkley,
Right,
but I'm just
but,
saying
hey.
I think he did enough that he'll be fine.
That's good. Now we know Zion hasn't come back yet. Zion Wilson from your Dukies haven't come back yet from injury. What would it take for him to be able to play again this season?
I mean, I think the short answer, he is going to play, but I think they want to be assured that he is 100%, kind of on both sides. I don't think Coach K and Duke is the kind of team that is going to rush him back at the expense of his own health. They understand what's at stake for him down the road, and at the same time, Zion is an ultra competitor, loves Duke, loves his teammates, wants to be back out there. So I don't think there's any disconnect on it happening. I think it's just a matter of making sure he is truly 100%, so there's no risk for him injuring himself worse going into next year.
Putting him in the right drills,
Yeah.
making sure he's cutting the right way.
Exactly.
things
Yeah.
like that.
He's probably already been doing some of that cutting, change of direction stuff in practice. I wouldn't be surprised if they're completely cautious and even wait until the tournament to have him back out there when the games truly count. Now, in a perfect world, you get him back before then, so you can hopefully start to mesh. But we'll just have to see. I know they've already announced that he's not playing today in the Miami game. So
And even as you as a doctor, you can just see how he would do that drill, and you're able to see whether or not he should even be out there.
correct.
possibly.
Yeah, you can look at how they're moving, how they're landing, how they're cutting, and you can see those things.
Yeah, I think that I never knew so many Duke fans that believed in God. So I heard a lot of prayers. Anyway, prayer, what they call it in the
Prayer
morning?
warriors.
Prayer warriors.
The prayer warriors came out.
Anyway,
Please.
so let's move to baseball. We mentioned that baseball is coming up. Kansas City Royals catcher Salvador Perez. This is the 2015 World Series MVP, and he will possibly be out for the season after going through Tommy John surgery. How does that impact the catcher for the future? You know, you don't hear it that much with catchers. How would that impact him going forward?
Yeah, so a lot of people don't realize, I mean, catchers most of the time can throw almost as fast as pitchers. I mean, when they're throwing to second base, they're throwing mid-90s usually to get it there. So they're putting the same kind of stress on their arm, and it might not even be conditioned as well as a pitcher. So we do see it in catchers. There's just not the volume that you see it in pitchers. And it's one of those things that ulnar collateral ligament, or the Tommy John ligament that you hear everyone talk about. In throwing athletes, if you were to get an MRI on 100 guys that weren't having any symptoms, every single one of them is still going to show some signal and damage. So it's not whether you have it or you don't. It's, do you get it to the point where it starts to become symptomatic and affect your throwing ability and your velocity? And it seems like he injured enough the other day where it's at that point. And so if he has a surgery, he will be out for the entire year. I mean, we've kind of seen the protocol where most guys are getting back, maybe losing, a mile or 2 per hour off their velocity, but still being successful. I don't think it'll affect him as much as a catcher, as a pitcher, but it's so important for him to throw.
But okay, so I'm glad you said that, because with the catcher, so if he does that, like you said, it takes a mile or 2. Baseball, I mean, pitchers is different, I would think, because with pitchers, you got other stuff you can throw. Sinkers, you can throw curve, whatever. Whereas catcher, if I'm a base runner and I know you had Tommy John, oh yeah, I'm about to try him.
No, but see, at that point, that's when you do something different, like with Wilson Contreras. He as with most of the Cubs pitchers, right? Especially with John Lester, right? He can't throw to first and things like that. So what Wilson does? He snaps at the first after a pitch just to keep him closer. So it's going to be a lot of other things.
But even with that, though, but Wilson Contreras, he has an arm. He can do that. This guy's losing 1-2 miles per hour. So do you think that will just affect him? And I know you're not a GM, but as a GM, would you say, all right, maybe I shouldn't, I don't know if I should move, maybe I should put him at DH or?
Yeah, I mean, he's a bigger guy. He's not very fast. I could certainly see him becoming a DH one day, but I think it all depends on how he comes back. I think he is known for having one of the better arms in addition to a good bat. So I think we'll just have to see. The catcher for the Mets that was their starter, Travis d'Arnaud, is coming off the same thing last year, Tommy John surgery. So kind of see what happens with him. That might be a little bit of a blueprint to what'll happen with Perez.
Well, how does that affect them as far as hitting? Because we always hear, like, with those kind of injuries, how it affects the arm. But how does it affect them with swinging a bat?
Yeah, not pretty. I mean, there's been research studies, not a whole lot on bat velocity or anything like that, because it's not the same kind of torque that you're putting on the elbow when you're throwing that you're coming through with a bat with your swing. So honestly, it really shouldn't affect him too much from behind the plate. It was the same discussion with the Japanese player for the Angels that was playing both ways, Ohtani, who had the elbow injury, and they were talking about shutting him down from pitching because of his ulnar collateral ligament, but still letting him DH and hit because it wasn't going to really affect that. So
now we know Kershaw's been held from throwing this spring because of his shoulder. Now we've been saying, Kershaw on the injury list more than disabled list more than we've. Actually, they changed the injury list.
You got to be PC,
right?
Be PC.
Because of the injury list more lately. Do you think it's more of a precaution, or do you think this is becoming something serious?
I mean, I think it's something. I'm a little nervous. I mean, I'm not a Dodgers guy, not a Dodgers fan, but if I was a Dodgers fan, I would be a little nervous because he's had injury issues over the last few years. Missed a lot of starts. I think in 2016 and then some last year too. The fact that he's already talking about soreness, and this wasn't even thrown off a mound, this was just playing catch, that he's already talking about soreness. Now there are reports now saying it's feeling better, but I mean, if your arm is already sore when you're just playing catch and not even thrown off a mound and the season hasn't even started, those are red flags to me. So certainly they are going to be precautious, but at the same time, it does make me a little worried about his health going throughout the year.
Yeah, that does, because
You haven't even threw a pitch.
if he's,
In reality.
I mean, because then I would call the doctors and say, hey, you know, I don't pitch or anything like that. I'm not near being a pitcher, but I have the same problem.
You better
when I
not
play
put your, you
when I
better
play
not
catch.
put your,
Look, no, I'm
yourself
saying, when I play
in-
catch, look, when I play catch,
That's
my shoulder's messed up too.
because you're an older gentleman.
But my point is, no. But my point is, they need to. That's concerned. If he going through the same thing I'm going through, I call Kershaw, have a drink with him. Hey man, I'm going through the same thing.
He gonna
I
say,
put icy hot on mine. So
well,
just,
you don't get out my face. I gotta make 25. I gotta make 20 million this year. Try to go for a World Series championship.
yeah, but no, we appreciate you, Doc, for coming on. And once again, it's Dr. Donald Fowler III, orthopedic for OrthoAtlanta. And appreciate it for coming on, man. And you know, next week is the same thing.
Always glad to be here, guys.
Yes, sir. All right, we're going to be right back. We're going to be back with What's on Our Minds. Keep it here.
Have a sports injury? Need to see an orthopedic doctor? OrthoAtlanta is one of Metro Atlanta's largest orthopedic and sports medicine practices, providing orthopedic and sports medicine care for the whole family. With 37 physicians and 14 offices, the practice provides the highest level of care for injury of muscles, joints, bones, and spine. OrthoAtlanta offers convenient access to a full range of musculoskeletal surgeons and specialists. OrthoAtlanta also offers on-site physical therapy, pain management care, MRI imaging, and workers' compensation care. The OrthoAtlanta surgery centers in Austell and Fayetteville provide cost-effective, same-day surgical procedures in an accredited outpatient center. Hip, knee, shoulder, back pain? OrthoAtlanta has you covered with specialists in all areas. Same-day appointments, orthopedic care for the whole family. OrthoAtlanta, Atlanta's choice for orthopedic and sports medicine care. Learn more at www.orthoatlanta.com.